Good Chair, and I want to thank you all for joining us today to hear feedback from the Global Peer Work Consultation. Eurobot is very excited to have been a partner in this collaboration led by MDM, Input, Increase, the European Sex Worker Network, COACT, and Euroinput. I want to welcome Luca Stephenson, the coordinator, who joined us. And I wanted to tell you that peer work and community-led models are increasingly recognized as a key part of the public health response with people who use drugs. Peer work has evolved in different country contexts, demonstrating again and again the peer works and can be tailored to fit different challenges and cultural contexts. It is clear that the drug using community should be seen as an asset and partner rather than being framed as the problem as it was. We have three speakers today. It's Judy Chang, Executive Director of Input. Judy is a key global advocate for people who use drugs in UN and other global bodies. In addition to her strong leadership and advocacy work for our community, Judy also explores our world from an academic perspective. Today, she will talk to us about an exciting paper that she authored called Peer Drive or Driven Peers, which gathers and reviews the evidence of peer work in the Global South. Shall we have a Q&A with Judy before, or then we have Matt, Roy, and Christos. With us is Matt Southwell, Project Executive, Euroinput, and also...
Daphne, we just stop. That's the introduction. Now go to Judy.
Okay, perfect. Yes. Judy?
Thank you for that lovely introduction, and great to be here. And thank you so much to Euroinput for organizing this series of webinars. So I'll just share my screen. Bear with me. I'm not. Okay, everyone's got that. Yeah, so as Daphne mentioned, I just wanted to share a piece of research that was done in a community and academic partnership called Peer Driven or Driven Peers. So it was a rapid review of peer involvement of people who use drugs in HIV and harm reduction services in low and middle income countries. And as you can see from the list of authors, it was a collaborative effort. So it was a two-year it started in 2018, so I guess a 3-year project. And it was funded under the Bridging the Gaps program. And we wanted to do this research because, you know, we know that there's a lot of, well, not a lot of, but there's political, the political declaration, the 2016 political declaration, it does talk about the importance of community-led responses and emphasizes that 30% of HIV funding should go towards community-led responses. But we also found, of course, as we all know, that there's this big disjuncture between, you know, high-level commitments on what we were able to obtain at the high-level political space, and then also what happens in practice. And we knew, you know, there's a lot of evidence and we know about the impact of peer involvement in harm reduction services, but it's not usually, you know, brought together. So we wanted to, you know, bring kind of the research together to really show all the varied impacts that peer involvement has within harm reduction, and also look at, you know, how, you know, why it works and basically how it works. So we started with, you know, a few key research questions that we wanted to, you know, guide our thinking on the piece. So the questions that we asked were, you know, what roles and forms do community involvement take within harm reduction services? What are the potential impacts and outcomes on service access and quality? What are the mechanisms for these roles? So how do they work, and, you know, why they work? And also, you know, to look at context and how it shapes roles and outcomes. So, thinking about structural context and criminalization, stigma, and discrimination. So we applied these research questions to a literature review, and at the end of it, when we applied our criteria, as said before, we looked at low and middle income countries, because we found that there was more kind of evidence in the global north countries rather than the global south. And at the end of kind of applying our criteria, there were 29 articles that we ended up including in the research. And just want to say as well, like across the 29 articles, there were 2 set in sub-Saharan Africa, 17 papers from the Asia Pacific region. There were 3 from China, 6 from Vietnam, 4 in Thailand and India, and also 5 studies in the ECA region, so Eastern Europe and Central Asia. And also 5 other studies were multi-country comparative research projects as well. And there were different range of methods from the studies. So some were quantitative, including randomized control trials. So considered, the gold standard of research, and 6 were mixed methods. So in our results, as we said before, one of the key questions was looking at the various roles that peers play. So out of 29 articles, we pulled out harm reduction education, of course, direct service provision, peer support, counseling and referrals. We pulled out the mechanisms, so how peer roles work, and came out with they work through trust and empathy because of the trust between community members and peers. There was, information or data on the community knowledge and experience, which of course, clinic professionals, clinic people and program personnel, don't have. That peers play this bridging role, so between clinic service delivery environments and peers on the ground, able to, kind of navigate connections and, provide information, and basically, be this kind of two-way mechanism. And of course, peer workers also play a role model mechanism. So we also, most of the articles didn't really describe context, which, doesn't come as much of a surprise, because I think, we don't really look at, the impact of criminalization, including fear of arrest and detention, on peer workers, and understand that, peer workers are placing themselves at risk, or they're being placed at risk because of the structural environments. The context was also clinic and service delivery environments, which don't engender trust amongst people who use drugs. They can be very cold and, distant. There are other barriers such as fees, geographical distance, and basically, not often being a very welcoming environment for people who use drugs, and of course, stigma and discrimination within the programs and amongst, clinic staff. So importantly, we of course wanted to look at the impact and outcomes of having peer involvement within these services, and probably not much of a surprise to people, but there was reduction of HIV incidence and prevalence in some of the that some of the studies focused on. Definitely a lot of the studies mentioned, safer injecting practices because of peer involvement, and increased access to acceptability and quality of HIV and health prevention, care and treatment services. And of course, one of the outcomes was lessened experiences of stigma and discrimination as well because of peer involvement. Sorry, right here. So then we move to the discussion section, which I think was often the most interesting part. And of course, across the literature, what came across as well is that, even when peers are involved, most of the time, it's still very marginal and instrumentalized roles where, peers are, kind of following the objectives of others and not, allowed to or given the space to set the objectives. So we did find, a lot that supposedly, peer-driven services often become of driven peers. So, peers we're always responding to priorities and goals set only by others. Of course, there were many challenges associated with peer work, which I think other people will discuss as well. But some of these challenges are unequal and disparate payment structures, peer workers not being remunerated properly, sometimes often, not at all, and expected to be volunteers. Working conditions, can be more difficult. There's often limited or lack of support. And, all of this, not surprisingly, generates tensions, undermines peer empowerment, and of course, then negatively impacts on the retention of peers in the delivery of services, which ultimately, impacts on, program quality overall. So we, of course, wanted to come up with some recommendations as well after scanning the literature. So some of the, strategies that we set out in the paper was, of course, the need to address criminalization and stigma. Of course, this is not, a short-term goal, but it has to be, it is a long-term goal, but, it always needs to be, kind of a focus. And I think part of the responsibility in this work, is also to be working to address these structural barriers, because things aren't going to improve unless, the legal environment improves. It's very important to fund networks of people who use drugs. So, networks where people who use drugs are in leadership positions and, able to influence decision-making, collectivizing, so able to, come up with community priorities that are defined by ourselves. And then, of course, through that collectivization, better able to influence, for example, programs to make them, more welcome and appropriate and for people who use drugs, basically. Third, that there should be the champion of relationship building with policymakers and researchers. As well, so that, people who use drugs are, have direct relationships and not having, others act as gatekeepers. 4, to foster organizational cultures and resources that respectively utilize peer knowledge and skills and value that as well. And that researchers, policymakers, and people who use drugs, need to be seeking new ways of engagement, and that our focus really should be, I think the underpinning, kind of goal is to be able to shift that power and also make room for new forms of knowledge making and praxis. So, basically shifting the way that we, do things as well, and really valuing the knowledge and skills that peers provide, in and of itself. So just in the conclusion, we wanted to emphasize, like, circling back, needing to bridge the divide between, high level political commitments and what happens on the ground, and that, really emphasize that we're not going to be able to meet this target unless we really do focus on the expansion and diversification of roles for peers within policy programs, as well as research, and that peers need to be acknowledged not only as representatives of their own communities, but as equal peers of policymakers, researchers, clinicians, and staff whom we work alongside and advise daily. So that was it. Thanks, Daphne. I don't know if there's any questions. I'll stop my share screen.
Thank you, Judy, for the very interesting presentation. It's really very interesting, and we're ready for your Q&A, I think. So let us wait for the questions. Anyway, we have very enthusiastic comments. We have lots of peers with us. So,
Can I ask Judy something?
yeah, please, please.
I raised my hand, but you did. Okay.
Sorry, I didn't see.
I want to put it in the Greek environment here in Greece. We have problems about the ongoing competition that is going on between professionals and peers. And if there are any way or guide to avoid all these troubles, and also in the best environment that we have in NGOs that appears working fine with them and get paid, and slowly they became part of the NGO more in their life. They became part of the NGO and not part of our movement. They left totally from our movement. And I wanted to ask Judy if she has any answer for this. Thank you.
Thanks, Christos. Yeah, I think it is a difficult situation. I think it's becoming, more difficult as well because of competition for resources. So yeah, I don't think there's an easy answer. I do think, as people who use drugs and as networks, we have to be, of course, aware of these dynamics. And of course, at the end of the day, working for or, advocating for things that work for us. I think there has been discussion amongst peers also about, how to maybe create standards of, true allyship and some type of standards that we can, use together to, before we think about, entering into partnerships, or at least, being able to have some criteria where we're able to, judge. So, that was brought up by Louise Bill Vincent from the US network. So it's something, that I have been thinking about whether we should be, getting together and, defining our own, criteria. So we have a basis to, decide, if we enter into partnerships or not, because I think a lot of the time, partnerships can be, we're giving more than we get back kind of thing.
Yes.
So
thank you, Judy. Thank you.
Very interesting. Has anybody any questions? Any more questions?
Can I just? Hi, Judy. Nice to see you, and the great work this study. I was wondering because we have now the European strategy rolled out and waiting for the action plan. And we have 11 strategic priorities with the same framework, where we have the same back-mind idea that we are going to stop drugs, and still we have dismantle organized crime, increased detection of precursors or traffic routes, and so on. So this structural vision of the world of drugs, and seeing that in 11 points of strategic action, we have just 3 that really address: one for peers, one for civil society engagement, and one in risk and harm reduction. But we can see in this strategy that these 3 issues are subordinated to a bigger framework, where we still are, we are the ones we see things wrong, despite we'll never achieve the world free of drugs. How can we do better in Portugal? In Europe, sorry.
yeah, I think it's, globally and across the world, and because of the drug control treaties, right, as well, like from, what was it, last week or the couple of weeks before C&D, I mean, yeah, the goal of the drug-free world, and Yeah, it's, incredibly, of course, what we're all fighting against. And I haven't seen the EU drug strategy, but I guess it's not surprising that it is, linking up with, the global drug control treaties as well. And I think, part of our role is, pushing back and always trying to change the narrative and, giving positive, stories about drug use and, countering that narrative. So yeah, I feel like it's we're all in it for the long haul, and it's a long fight. And I think, at all kind of levels, needing to challenge that, local, national, regional, and global. And I think, using media, advocating at the national, regional, and local bodies. I mean, we are seeing, very, very, very small changes. And it feels like we're obviously fighting against this huge thing, but, I think there are spaces to, continue to challenge.
I see it's maybe the first time that promote peer work, peers written like this, and so I see those small steps, but it's like I feel they put the words in the correct order and the phrases, but when I read that, I always feel that is very empty speech, and and if we don't push back, they will not do it. They will not be aware that they are the ones that should give us space and power to develop, I think. So thanks.
Thank you, Henry. Do we have any more questions? I would like to
maybe I have a quick question to Judy. Do you still have time, Judy?
Yeah.
All right. Good to see you again. Hey, I was just wondering, when you looked into the literature, did you come across any pieces that talk about the cost efficiency of peer work? Because this is obviously a bit of an ambivalent area, but it can be hopefully a powerful argument to make. I was just wondering if there's anything that came up when you looked into the literature, and then perhaps if you can reflect on that from a high income and a low income perspective.
Yeah, so we didn't come across, we weren't specifically look at cost efficiency, but nothing, really came across from that angle. And I haven't really heard of, literature really from that angle either, especially as, they're talking more about obviously doing more with less money with HIV. So I think, there's a lot of talk about cost efficiencies and task shifting, but I've never seen anything in detail looking at, peer, the comparative cost efficiency of peer work specifically versus non-peer work. I mean, I think there's even a problem, sometimes we're trying to get information on how much money goes to, peer work or community-led organizations. And that's a basis to then, I think, start looking at cost efficiencies. But I don't think there's anything, out there, even at the global level of that. So yeah, I think it's definitely a gap, work and looking at that.
Okay, thank you. Yeah.
I see. Do we have any more on the questions on the chat? I haven't really looked at it. If anybody has noticed.
So just one question was from Christine from Sweden. Christine was asking, feeling the sort of challenges of organizing in Sweden right now is how do we think people can become active and engaged in this work?
Yeah, so usually, would be connect with national networks, local networks. But yeah, I understand if there's some challenges in some places. But I know also, of course, you know, Europe do a lot of organizing work and, you know, have different forums and communication forums about, you know, connecting. And sometimes I think it is just about being able to share with other people what's going on in your life, especially with COVID and lockdown and, you know, etc. So I think somehow, you know, either connecting with national or regional networks. I don't know if I answered that question, but yeah, I think it is important, you know, to be connecting with peers as much as possible. And I think people have been feeling a lot more lonely and isolated, of course, because of COVID. I know in the US, you know, they're just organizing, I think, webinars so people get to talk and connect, and, you know, perhaps that's something, you know, we should look at more as well, just finding ways for peers to be able to connect globally and, you know, kind of decompress as well at the same time whilst finding out, you know, kind of what people are working on.
Okay, I see another hand. I see Christos. Christos, you have another question, I see. Can he hear me? No, maybe it's the hand he raised before.
It's before, sorry.
Before, okay, sorry. I don't see another question in the chat. I don't know. Oh, no. If anyone wants to raise a hand, let me see. I see a little hand here. No, it's Christine. Christine, it's her question again. Before we check if there's another question, I wanted to acknowledge Sam Hodgetts from MDM is with us and has done the background work that brought such a dynamic and truly meaningful participatory process together. And I wanted to say that we believe that these recommendations and that sort of partnership will go on to be very significant and at this key moment for community-led approaches. So I wanted to acknowledge her. And also, after we see if we have another question for Judy.
Yeah, just so Sergio from Portugal is asking, do you think there is still much to do to accept that peers can be coordinators of their own teams that they're working in? So this is about the career progression issue.
Oh yes, I was just about to type the answer. But yes, definitely, I think there's a lot more work to do, and I think, you know, from the consultation that MDM organized as well, and this, you know, on the last of a series, I think, you know, we're reinvigorating these dialogues again. And, you know, I think, yeah, I think there's a lot more work to do on this space. And I think, you know, these dialogues are, you know, the beginnings of that as well.
Okay, thank you. Let's wrap up because I know Judy has to go. She has a very important other meeting. So I want to thank you, Judy, very much for your participation. You're always a joy and full of lots of information, and we always learn from you. I'm very grateful. We are very grateful to have you. So thank you very much.
Thank you, Daphne and Matt, for those kind words. Yeah, sorry, have to go, but yeah, wish you a great webinar and we'll follow up.
And for us, I wanted to ask Lucas Stephenson from Increase to comment before we go on to Rui and Crystal. I wanted Lucas if he wants to make a comment on the partnership with sex workers.
Judy, I think that Daphne, I think that might be easiest to do that after we've shown the video, because then people understand the context to it. But Luca, if we could give you a warning, that it would be great if you could comment at that point. That would be cool.
Oh, that's lovely. Are we seeing the video now? Or
so now it's me. So now the introduction for me.
Okay, great. So now it's the time to introduce my colleague, Matt Southwell, who is project executive of Euroinput and also a COACT consultant. This event started with a consultation with peer workers, working with sex workers and drug users around the world. We're grateful to all the drug user and sex worker projects and groups who support these focus groups. 15 focus groups took place in 12 countries. Matt will tell you more, will summarize the feedback from these focus groups. Matt, to you.
Thank you, Daphne. Look, and firstly, thank you to all of the drug user groups and sex worker groups and their partners who facilitated this really exciting range of discussions. When we first sat down and discussed this idea, we thought that if we held 5 focus groups, that would be a really valuable backdrop to this important consultation. But in fact, the process evolved and grew, and we had sex workers in Russia, Morocco, drug users in Nigeria, in Afghanistan, and then also from our own network, we had drug users in Portugal and the UK, all coming together to share their views about what is it like to be a peer worker. And I think we've understood for some time that peer work has really demonstrated its critical role in the harm reduction and the HIV response. And I think a number of us that have been doing consultations or with peer workers or running drug user groups or sex worker groups or have been programmers have all understood that there's some developmental challenges that we're facing. And so I think what for me was really interesting was bringing together as we did, the people who had run these various different focus groups to come together with MDM, with EuroMPUD, with ICRSE, to sit down and say, look, what have we learned from this process? And what I'm going to show you in the next 3 slides is just a summary of the key issues that peer workers around the world identified. This was then brought together into 5 key themes, and you'll see those themes explored further in the video that Ernst will introduce. What happened as a result of this consultation was 5 sex worker and drug user leaders, or in fact a larger group of sex worker and drug user leaders, facilitated 5 discussions among 75 key stakeholders, really from very high level partners, programmers, donors and UN bodies, all coming together to really explore the issues that we identified as peer workers. So let me go back to the source. This is what our peers told us when they were consulted around the world. Firstly, that we all understand that we bring to this work this concept of privileged access. We are trusted by, we understand how to access, we understand how to give advice, we understand how to take commodities of public health into the worlds of our communities. And we understand how to mediate the challenges that many people face when undertaking peer work, and also just living the life of being a drug user or a sex worker. And that many of our community members were driven by this sort of sense of community solidarity. They wanted to give something back, sometimes to the services that had helped them, and often to the communities that they were members of. And in many ways, when people first start out, peer work is typified by being very optimistic. It's a sense of development for the person, and they grow personally through the experience. And that builds their sense of self-worth, their capacity, and their motivation. The challenge was, and we saw this in the UK focus group, where we had someone who was 6 months into the work and then other people who were 20 years into the work, that optimism can change over time. And if there's a lack of recognition and acknowledgement for the work that people play, they experience lack of career opportunities, they continually feel that they're being paid far below or nothing compared with partners, and over time that feels increasingly unfair, particularly as people see like students come in and get salaried jobs with far less experience that take them into an immediately higher salary bracket. All of that over time can lead to anger and resentment. And this fact that there seems to be a two-tiered system where some people coming in with learned experience have faster career progression, higher salaries, and also improved access to training and professional development opportunities. And that all creates this sense where peers feel we're taking the greatest risks, but we receive the lowest pay, and we also have the most limited access to career development opportunities. And that tension between the early experience of optimism and the potential to go down this path of increasing frustration and resentment, I think is something that is an endangering of the future of peer work. So many countries were also practically hindered by the lack of an employment role or status for peer workers. So for example, in Portugal, different people in different career paths have different statutory roles. But if peer work doesn't exist as a status, then people are often paid as security guards or paid in much lower status roles, or they're just given incentive payments rather than having proper salaries. And the challenge is that people to be classified in these more formal career roles often need to be graduates, and again that creates challenges around who can access those roles. Excitingly, we're seeing Portugal having government level discussions now about how to create status for peer workers, but I think that speaks to a wider task that is necessary for many countries around the world. We also identified that one of the functions of peer work, and one of the ways we have privileged access, is that we identify ourselves as part of the community. So we're saying, look, we are peer workers, and that means because we are ourselves sex workers or people who use drugs. And that's key to us being effective. However, with that effectiveness, with that privileged access, also comes the risk of stigma and discrimination. Afghanistan, for example, talked about the challenges of interacting with drug suppliers who were very fearful of these outside agents coming and messing with their customers. Sex workers in Kenya talked about the challenges of professional partners becoming resentful over time that they were self-organizing. One of the challenges can be that to the general public, so you might have immediate tensions in your own community as being seen as an outside agent or having different goals from drug suppliers or people managing the sex industry. But at the same time, people can also face exposure within their communities as drug user or sex worker activists, and often this can be mistaken as being committed not to championing the health and rights of people who use drugs, but advocating for drug use or advocating that people should take part in sex work, which then is seen as somehow contrary to social norms. And as I was saying before, as the Kenyan sex workers highlighted, when programmers see peers starting to build their confidence, build their organizations, and developing their own self-organizations, rather than seeing this as an optimum and desirable step for managed peer teams to become self-organized, this can be seen as a threat, as if somehow people are getting above themselves and taking on roles that really should be left to professionals with proper training and expertise. Now, which of course we understand lived experience and learned experiences are two different things. Some carry both, some carry one or the other, but when the two can be mixed together, it gives both groups a chance to achieve more than they can achieve on their own. And I think one of the things that we picked up through a project we did around the employment of peers is really understanding that if we are asking people to use their privileged access and put themselves on the front lines, where as a criminalized population they may face police arrest, get involved in corruption with police where people are stealing money from drug users or sex workers, sometimes having to mediate violent, threatening drug suppliers who may be unhappy about harm reduction taking place in their settings. One Afghan peer worker talked about being assaulted by methamphetamine suppliers for giving an honest appraisal of the risks of methamphetamine when it was being heavily marketed by drug suppliers. drug users in Kachin talking about how they were able to take needles and syringes across the conflict lines of the war between the Burmese government and the Kachin Independence Army. When asked how they did it, they described the fact they'd been to school with the Kachin Independence Army members, so they had a memorandum of understanding that allowed them to work across these conflict zones. But remarkable bravery from these peers. And then at the same time, also seeing vigilante groups in a number of settings that provokes risk both for drug users on the ground, but also for the drug user groups and sex worker groups who are standing up and identifying. We've seen in a number of African settings, drug users being essentially executed or summarily executed in the street for being involved in crime or being seen to be acting against the wider community norms. And importantly, and I think one of the drivers of this project from MDM was actually seeing peer workers in Myanmar being put in prison for 2 years just for doing their job, giving out needles and syringes, being arrested while doing it, and then spending 2 years in jail just for attending to the health of their community. So lastly, just a final point, which I probably didn't make enough emphasis of in the actual global consultation, was another key factor is that throughout the COVID pandemic, peer workers from the drug using and sex worker communities have really, really stepped up to deliver public health and rights. Now, for those of us who are community members, that's a natural community solidarity response, which I don't think surprises many of us. But when it's mixed with this incredible privileged access and technical expertise that we have as communities, I think it has huge impact. And I think a number of the webinars we've done have demonstrated that peer works in Europe, and I know many of our peer partners around the world have also been demonstrating it during this time. And it's important that many of our academic and NGO partners and multilateral partners have also recognised and documented this factor. And it's a key thing that will now help us as we advocate for community-led harm reduction, community-led models and peer work in the future. So thank you. We can't hear you, Daphne, you're on mute.
I'm so sorry. I apologize. Thank you, Matt. It was very interesting. Christine wanted to take a print screen of your screen, and I said yes, you can. Although we always share what we present. And Luca is here, I can see. And do we have any questions? I see a little hand in Christine. It's a previous one, I guess.
So that would be a great time to ask Luca maybe to give feedback from the sex worker networks about their experience of being part of this process.
Sure.
Yes, Luca.
Hi, thanks Daphne, and thanks Matt. Thanks for having me. And yes, it was very important for ICRC to be part of the consultation and the roundtable. I don't have many more points to make. I think what's really critical as well is the building the capacities of peers, whether like people who use drugs or sex workers in policy as well, which I think sometimes we see organizations which are like well-meaning, hiring or working with peers in terms of service delivery, like, okay, you're a sex worker, you know the community, go distribute condoms in this or that area, which is great, a good start. But it's also really important that peers are involved in the development of the organization, decision around what are the priorities in terms of like services advocacy. And for example, this is what we also like really like to work with Doctors of the World, with Médecins du Monde, is for example, you might have seen recently that 261 sex workers in France are taking France to the European Court of Human Rights against the law on criminalization of clients. This is the highest number of people who've taken a case like this to the European Court of Human Rights. And it's amazing to see sex workers, many of them undocumented migrants and facing many forms of intersectional discrimination, going all the way to European Court of Human Rights. And in that process, Médecins du Monde was extremely supportive and was really facilitating the process, which can be, as you can imagine, very complicated, and for many sex workers, completely out of reach. So I think working with the community doesn't mean just giving roles in terms of service delivery, of delivering condoms or like a harm reduction material, but really looking at like what are the structural factors that stop people who use drugs or sex workers from from being involved in organization and etc. So that's all I have to say really about this. And I think it's important to continue this form of consultation. I'm less, of course, knowledgeable about people who use drugs and like the harm reduction movement than I am with the sex workers movement. But what we see in sex workers is that things change very fast. When it comes to sex work, you know, the situation for sex workers 20 years ago or 10 years ago is completely different than now, especially post-COVID. Just in terms of like working places, you know, most sex workers now, many sex workers now like work online, for example, and the risk and the associated to this are very different than working in the street or working in brothel. And it's only working with the community that we can learn how our communities are affected by changes like this. So yeah, thank you again for having me, and I'm here to answer any question if needed. Thanks a lot. Thank you,
Luca. It's very interesting, and it's very important for us to have participation and contacts with you and with sex workers. Let me pass on to Ernst. Ernst Weiss is the harm reduction coordinator for MDM. He is a paramedic and nurse by background who trained with the learned his French from the drug users in the Paris Safer Injecting Facility. He has gone on to work in international development, championing harm reduction and community mobilization in Afghanistan, in Myanmar, with Médecins du Monde, and has supported Médecins Sans Frontières assessment for harm reduction in Iran. This project started with the consultation about peer work before the Porto Harm Reduction Conference, and Euroinput is delighted to have joined this development journey. Ernst also will introduce a video describing the global peer work consultation. Hello, Ernst. Passing to you.
Hello. Hi, everyone. My name is not Wise.
Oh, sorry.
No, it's okay. My name is Wisse, but yeah, no, just
pronounce Wisse.
Fine. I like if people call me Wise. It's a real pleasure to be here. Yeah, so I guess I have a bit of an easier task because my job is to show the video that is the result of all of your collective work. And I'm sure that some of the participants have been part of the processes that Matt already spoke about. Maybe just a few words from my side to say, you know, when I started working in the international field and coordinating harm reduction programs and working with peers, I just realized how much harder it was than it looks on paper. And I made so many mistakes, and I found there's such a big difference between what we see and how we talk about it and what we say in meetings, and then me after, you know, trying to do my job and really struggling with a lot of things and not understanding also a lot in the beginning. So this has always been a bit in the back of my head, like, is this only me or what's going on here? And over the time, also working with Matt and Luca, just understanding more about how peer work fits within harm reduction programming and the difference perhaps between how we communicate about it and what is the real world, led to an initial conversation we had, like you said before, in Porto, where we just try to look internally already. What's going on? What are we doing wrong? How can we be better in protecting our colleagues that indeed, like Matt said, they have had colleagues that disappeared into prison. We've also not always been that great in protecting people, and many things that we needed to review internally. So that's been a real journey, and I'll just put in the chat for everyone a link to an earlier video, so not the one I'm going to show you now, but an earlier video where we try to capture already internally all of the things that we should do better. And I'm not saying that to now announce that we are great, but we are trying to work on all these things that you will find in that video. So all of that in the process continued and led to what Matt has been presenting earlier on, and where Luca has been really instrumental in participating in the global consultation, where we asked many people around the world around what are the challenges of being a peer work and what are the differences between what we all think how it should be and what is the real world. Based on that, we tried to bring in a group of people together that could hopefully influence this and change this. And we were quite surprised because we were hoping to invite 50 people, and we were at some point trying, needed to hold people off. Like, no, you can't come with 10 people. This is a roundtable discussion. We need to try to make this as dynamic as possible. And I know Sam is hiding in the participants, but she's been leading all of this and putting it together. So that was about 2 weeks ago, I believe. We have tried to capture the discussion and the outcomes in the video that I'm going to show you now. So let me put that up for you. I'm very happy to continue the discussion after to talk about the content, and perhaps also you have some ideas what to do next with all of this. So let me try to share my screen. I do realize that some bits might go a little bit fast. We will make another version available very shortly, and we will make sure to share that link with you. So here is the video. Peer work has been increasingly recognized as the most efficient model of intervention in harm reduction programs. Peer workers' expertise and engagement within the community is invaluable in delivering outreach and ensuring access to services.
Despite agreed language and recognition of peer work in international guidelines and reports, the reality is often much more challenging.
Partners in this space came together and facilitated a global community consultation of peer workers to talk about their daily realities and highlight areas for improvement. Community leaders organized 15 consultations among drug user and sex worker peer workers in 12 countries.
This led to a roundtable discussion of 75 people from 25 countries, including representatives of the UN, donors, public health specialists, programmers, and civil society, with peer workers at the heart of the discussion. The discussions were structured around the key themes identified in the consultations.
1. Fostering self-organization. Programmers rely on the privileged access and lived experience of peer workers to reach and engage the communities in order to deliver services. But once the community is ready to self-organize, the initial implementing organizations should step back instead of competing for the often very scarce resources. If funding is scaled back, the community-led initiatives are always the first to be cut.
2. Career paths and employment conditions. Peer workers are the cornerstone of many programs, but they are often the least protected, recognized, and the most exposed to risks. Most don't have equal worker rights with salaried positions and benefits such as health insurance and social security. In many contexts, peer work is not recognized as a formal profession or in national health systems. Evolving professionally can be very difficult for peer workers, and they often reach a so-called glass ceiling, getting stuck with limited opportunities for career progression, reflecting the different value placed on lived and learned experience.
3. Safety and security. Peer workers often work with and come from criminalized communities with inherent risks of arrests, harassment, and exposure to violence. Peer workers can provide access even in remote or difficult to reach environments such as conflict zones, which leads to further contextual risks. Navigating within highly stigmatized communities comes with additional risks, such as being misunderstood or mistrusted by their peers and the wider community.
4. Meaningful participation. Peer workers are the most legitimate to speak as a representative of their own communities. Many policy-making spaces are often difficult to access, with bureaucratic and language barriers that can limit peer workers' meaningful involvement.
Peer workers must have the option to do more than just service provision. They should be encouraged and actively supported if they wish to self-organize and/or take on a representative role for the community.
Those working with peer workers should respect this journey and take great care to foster their independence, rather than misreading this as a threat and competing in this space.
Lived experience and privileged access should be recognized skills in job descriptions and human resource frameworks.
Peer workers should receive proper induction training and should be offered ongoing opportunities for career development and progression, including into other professions. Training priorities should be agreed in consultation with those delivering peer work.
Peer workers must receive fair remuneration that corresponds with their level of engagement and responsibilities. They should have the opportunity to progress towards the same benefits associated with a salaried position, such as health insurance and social security.
The inherent risks associated with peer work must be mitigated through proper training, protocols, and risk management. Organisations must have clear processes in place for supporting peer workers if they are injured or arrested.
When engaging in community work, we must build the capacity and sensitize other actors such as police, religious leaders, and health officials to create safer and more collaborative working environments.
The role of peer workers should be understood by all stakeholders, including within their drug using or sex worker community.
Strong effort should be made to ensure peer workers have equitable access to local, national, regional, and international policy spaces. This should be facilitated by stakeholders at all levels.
To ensure meaningful participation, peer workers should receive training and capacity building according to their own level of knowledge and desire to engage.
I'll leave it with this, and I'm very happy to continue the conversation. I'm hoping you could hear the sound well, because I think somebody's breaking down my building in the background.
No, it was heard very well, and it's a very interesting video and very clear, with very clear messages. I liked it. I watched it before, and I think all will agree with me. Very wise, Mr. Visser. Let us all proceed to the Q&A section for all. You can either raise hands or put your questions in the chat and I'll see it. We have already one hand, I think. It's Christos Anastasiou.
Yes, thank you, Daphne. I wanted to ask Ernst about the translation of this video, because we are really very want to make. Is it possible in this video in YouTube to open the translation so we can do it? Because I think it's
that's an excellent point. I have to admit that the other video that I just put in the chat, we've translated to 7 languages, but then the problem was that it took us 2 years.
No, we will do it. We will do it. But is it possible to open this function of YouTube?
Yeah, it's a very good idea. I'll have a look at it, Christos, how to do this best. We definitely would like to make it more available, because that's the whole idea, right? So yes. I think there's an option to put it in YouTube and then maybe do some auto translate, or maybe perhaps if you have, you can help us, that would be fantastic.
Yes, I can help you with the Greek.
Okay, fantastic.
I'm volunteering about Greek language.
There you go, fantastic. If you are also interested in the other video, I would be very happy to
Yes,
hear.
of course.
Thank you so much. Thank you so much.
Yeah, so the other video is the video that came out of the Porto conference, which is a similar, was the first time that we used this cartoonist, who I think has done a really great job. And maybe we can, do you have a link of that one, Ernst, that we could also share in the chats for people to have a look at?
Yeah, I tried to put it in chat. I hope it worked. If not,
sorry, I may have gone too fast. I may have missed it.
Maybe it didn't work. Let me try again. There you go.
Perfect.
The one in French? Is it the one in French?
It is in English, I believe, and it has 7 different subtitles, so you can select which language you would like.
Okay. We have a little hand from Rui Coimbra.
Hi. Well, this was an amazing work, and really glad I had the opportunity to contribute a little bit. And I see how evident to us, how we can immediately see all these important issues that peers all over put forward and highlighted. I see you know, the importance of the clash with the real world. Judy and Input, they were highlighting the secondary place and role that peers are driven to. So there are lots of still, you know, frameworks of knowledge barriers, epistemological barriers. The way the world talks about peers outside of our bubble is still a world where they want to end drugs, where they want to change the world for an ideal, and all ideal is kind of paralytic. When you talk about self-organizing, having all these daily life problems, you know, solved or at least on the agenda and highlighted. Well, it's really a really systematic and organized way to put our word out, but the thing I see in Europe with all the populisms rising and maybe a little mistrust on institutions, on Europe itself, when we see all this kind of modern promises of how the world would work so well, failing and falling down. You know, what kind of more? I see peer work as a figure of democracy. You know, it's in fact it would be a great symbol of a participative democracy. But the near future with economical and social crisis, I mean, I think it will be so much harder to you know, to compete, to have some leftovers, to have some investment, and more important, to have that kind of regard or look at us outside the box. You know, we have to go for an ecology of knowledges and not just science, because science also, as a method, as a methodology, you know, if you have the wrong people asked, you know, you can have almost all the results you want following scientific methodology. And how can we find equal power for our knowledge? This is a huge question. Sorry, it's for all of us.
Yes.
Yeah, look, I think you're right, Rui. I think there's this fundamental sense of what is a participative process. And I reflect back on the sort of 10 years when I was facilitating this, not as a drug user, but as a professional and running an organization that was really invested in participative development and, you know, over time employed many drug users and saw drug users. In the end, 50% of my management team for the whole drug service were actually people who use drugs, because once you create a safe space for people where people can be honest about themselves, it attracts people. It really did. And not just the street drug users who came and played such a critical role at the front line, but also psychologists, nurses, other people who maybe couldn't be completely honest, but welcomed in a team where there was honesty. And I think that was critical. The fact that when drug policy changed and the Royal College of Psychiatry local representative, key professional out, and myself was driven out of the service, and I was I struggled with that for a long time. And then one of my left-wing fellow drug services managers from London said to me, "Matt, you just mobilized a bunch of working class drug users to run their own services. What did you think was going to happen?" And she said that to me with a friendly smile as a fellow left-winger, which was partly commendation and partly stop whinging, you don't need to be complain about it, this is the way the world is. But part of me thought, how sad, that a service is destroyed because it models meaningful participation, and that is seen as a threat to the dominant professional bodies of our psychiatry system and our medical system. And I hope we can get to a world where that's not the case, and that actually participation is seen as the fundamental part of what makes for therapeutic relationships in services. And I have to say the best anecdote for that, for me, was the partnership between the drug user movement in the UK and the Royal College of General Practice, led by the wonderful Dr. Chris Ford, who really showed that this learning partnership between people with lived and learned experiences makes both our work stronger as a result. And I think for me, that relationship was very healing after the difficult relationship of having attempts to do the right thing destroyed.
Yeah, thanks. I totally agree with this idea of complementing different knowledges, but it's sometimes so scarce. We are getting more and more, but I mean, when I think 2030 UN objectives, and it said good health and well-being for all. And when I see at the European level, we have a strategy for 5 years, I think this is so fearful. I think this is shows so lack of courage of politicians to follow evidence. This gives lots of fuel for populism and for narratives to come back to the 80s, to demonize drug users, to demonize the substance. This is already happening in not so big cities. The place where I live, I think it's a time capsule. I'm in Portugal, the cream country paradise. And if you go to the interior part of the country, very Catholic and conservative, I mean, you don't even have many harm reduction services, and peer work is something that cannot be even conceived. So there's symbolic salves in lots of different areas of the world, and yeah, I agree that when we come together and find that energy, it works, and we are many. So let's see.
I'm just interested whether that's how different this is for sex workers as organisations, because people who use drugs are criminalised in every single country of the world to varying degrees, but the criminalisation remains universal. Sex workers in some contexts have legalisation of the ability to work as sex workers. Does that change peer work, Luca, from your experience?
Well, mostly for Europe, I would say like the majority of sex workers are criminalized one way or another. So like even in country where it is legalized, very few sex workers are able to work legally. So for example, if you are a migrant outside of the EU, you're not able to work legally. Let's say Turkey, for example, like prostitution is legal in Turkey, but there's only really few brothels where people can work. And to work there, you have to be a cis woman. There's many like restrictions around it, the same with Greece. So we see that in the majority of cases, there is a form of criminalization. Of course, it does help if like ICRC and usually like the sex worker rights movement, we call for like decriminalization of sex work rather than legalization as we have in like some countries in Europe. But still, like a legalized system is better than a fully criminalized system. And in that case, it's like, yes, sex workers are able to work as peer and have like less burden. However, I think like in the sex worker rights movement, I think as the same with like any other social movement, there's also issues around like intersectional discrimination. And I think as a movement, whether ICRC or sex worker-led organization, we also have to be careful of not reproducing some of the discrimination we see in wider society. So we will see that many organizations of sex workers sometimes might not work, might not include trans people, for example. So we've been working with different organizations and there will be only cis women, so not trans women. And be like, well, why is there no trans women involved in your organization? And the same as like service provider would find like lots of reasons why they're not being more inclusive and be like, and we have to like call each other out in this way, or be like, well, even if you are like a sex worker-led organization, are you really working with a variety of sex workers, including, migrant sex workers, trans sex worker, MSM, sex worker who use drugs, etc. So that's a lot of work to do, but I think sometimes we're very good at criticizing service providers who deserve all the criticism when they are not inclusive of sex work, of people who use drugs or sex workers. But I think it's also important for us to reflect on our own mechanism.
That's very interesting.
Thanks.
In every country, it's the same, I think. We face similar problems. And there is a long tradition of discrimination, of no participation of the people affected the most in many, many areas. I'm glad to see you all now. You turned on your cameras. Do we have any more questions? I don't see any little hands, but
yeah, I see a question from Wes. So Wes has just started working with the Scottish Drugs Forum, helping to lead their new peer-to-peer naloxone program, and we're really looking forward to working with Wes as this work unfolds. I think he's highlighting this real challenge between being peer workers in a service where you can get caught between both sides of the situation. You're no longer fully a peer, and some peers may think you're part of the service, and then you're also not fully part of the service because you're not really a proper worker, you're still a peer worker, and that status is seen as lesser. And I think it's this interesting point that Wes is making, that on one level there's lots to learn from both sides, and you want to be in the middle, and that middle is a really helpful place where you can learn, but it's also a pressure place at the same time. And I think that's a really interesting reflection.
Can I add something? I have sharing just a recent experience in my hometown. It's a smaller city, and my phone is used in all different communications among users. So as my number of the mobile phone appears in lots of communications, now I have in the next 6 months or something, I will have to go to 20 or 30 times to be heard to testify, and then to testify again in court because of processes, most of them low trafficking. And I mean, how can we work and hand out naloxone and hand out needles and syringes, and then be kind of harassed by the institutions? Sorry, it's just so. Yeah, yesterday been to press charge on the police that heard me in the first time I went to testify. So
that's horrible. That's horrible. And I think it happens in many countries. I mean, the mobile phones are listened to, and we have in Greece many people who were arrested 6 years afterwards. Christo knows somebody. And they arrested the father too, 78 years old, because this guy used his father's phone. I mean, it's ridiculous. And it makes our work and everything so much more difficult and so futile, as you said, Rui. I mean, when there are real problems.
Well, not futile. I'm going to press charge against them. You know, one of them was invading my private life and counseling me to, you should leave drugs. You know, that is not good for you. Stop there. And the other guy comes from 6 feet away and with his finger, and we could put the process on you by complicity because you drive dealers in your car. So I was really bullied. So anyway, this in the country of the cream and of all liberties, it's kind of ironic, and so that's why I'm really seeing all the words in the right places when I look at UN and when I look at European strategy. You know, lots of things are so beautiful and then again so empty when you clash with the real world. You know, it's being that we are having to now have some kind of options given the pandemic situation. There's a need to rethink economy, rethink health and well-being. So I really hope that this will be a crisis that finally is used for good. You know, it's for people to be based more on rational and evidence arguments. You know. Yeah. Sorry.
No, we'll follow this anyway. We'll be asking you about it, and you'll be telling us everything.
I just wanted to maybe add around policing. I mean, having done, and I think many of us with great validity can highlight the challenges that we face in Europe around policing. And then, when I did a consultation with drug user groups in Southern Africa, I mean, the level of gender-based violence from the police, widespread reports in every country of women being gang raped by the police. And that wasn't just women reporting, it was also men witnessing it through cells, sexual police constantly using the pressure of people being caught with drugs as a pressure point to then demand sex. And just hearing that constant dialogue for women who use drugs. And then, like where Ernst and I both worked alongside the drug users in Afghanistan, every single day the police go to the drug scene to rob the drug users. And the deal is, would you like to keep your money? Or would you like me to take your money? Would you like to keep your drugs and just lose your money? Or would you like to lose both? And then one drug user that famously this situation was reported to the UNAIDS board by the very brave Rahim Rejaei, who's the director there. One drug user who had been given family by his family objected to the amount of money that he was about to lose, not the usual small amount, but a much larger sum. And when he complained, the police shot him in the leg with an AK-47. Now, the fact that the drug user, Rahim, then went in, documented what was happening, was put in handcuffs while documenting what was happening, and then was told if he reported it to international agencies, he would be set up and put in prison. And his bravery led to the fact that he was then documented and reported to UNAIDS and made as a presentation to UNAIDS, leading UNODC to ask the local police to come back to apologise to him. But I think that outcome was not at all predictable, and I think the bravery that we ask our peers to take on the ground, particularly in the most hardcore front lines of the challenges faced by our two communities, it always leaves me a bit breathless, really.
Yeah, and we have to try more for the women, because women usually in those kind of environments, and in Greece too, many times feel such shame for the sex crime that they cannot really. And of course, if you are a woman drug user, everybody can take advantage of you, doctors many times, and usually the police, of course. And this goes for sex workers too, cis or not, and gender fluid people. But we have to to try to support those people so that women too, or people who are in sex work or in more difficult situations, to have the ability to really speak up, because very, very few drug user women can really go out and say, I was raped or I was harassed, because I mean, your word doesn't count, and you're a woman and you're supposed to have provoked it. And it's very, very dangerous. And I think we have lots of work to do.
Yeah, I remember advocating for a peer who went to the police she was a sex worker and a drug user, went to the local police to report a rape, and they told her it was an occupational hazard until we got involved in advocacy, and then they took the case seriously. But it took us to go to senior management to get them to get their frontline officers to take it serious. And had she not been a member of a drug user group, that crime would have gone unreported.
Yes, if I can say a few points on this. With ICRC, we published a report in November last year on migrant sex workers' access to justice. And we know that so many crimes against sex workers are being non-reported. We know from fact that majority of violence against sex workers is not reported because the sex workers will not approach a police station, because in many cases, either the police is a perpetrator of the violence, or there's no trust in the authorities, in particular for migrant sex workers who are at risk of deportation. And I think especially when like sex workers use drugs, or people who use drugs also are sex workers, and overlap with other like criminalized identities, it really makes this situation impossible. And this is something that ICRC we make as a priority at the moment. We've also joined the European Union Victim Rights Civil Society Network. So we try to really push for the recognition of the vulnerability of sex workers in terms of like violence and reporting to police. And I think that's something we should really like push, maybe like also like work jointly on. There's a more and more focus on police violence, like the big movement coming from the US with like Black Lives Matter, etc. But in Europe, it's a bit less so. Like there is still like lots of discussions around it, and I think that's something that as criminalized community we should really like work together to push against.
Yeah, definitely we should, because there is a huge gap there. And as you mentioned, the migrants too, women and men, are suffering so much, and of course they can really have no power to approach the police or even speak up to journalists. And we are very familiar. Christos meets every day in the streets when he goes to Athens Center, the migrant people who are.
I think also they have a dark role in all these things, the lawyers, because they like the situation, because the 40% of their job is coming from those, from small quantities of drug users, and with the crisis, they don't have a job, and now it's a great opportunity. And we have to talk with the lawyers also to support us, because the most of the people in the parliament and in the European Union, they are lawyers, and they know very good the situations.
Now they are paid in gold. I don't know.
Yeah, but sometimes they work gratis for us, for PNFs, they have gratis many times, because they are so well paid that they want an alibi, I guess.
Look, I'm just aware that we're maybe like 5 minutes before the end, and I just thought maybe it might just be good to think about where this work could go, because I think that as you've seen in the video that Ernst presented, there's some really important recommendations. And as Judy was explaining, we now, the UN is committing to the idea that 30% of the HIV response in future should be delivered by community-led organizations. So if that is going to be the case, it's going to be increasingly important that we get the ethics of peer work right. So maybe to just ask my fellow coordinators of this work, I mean, who are on this panel, Ernst and Luca, where do you see this work potentially going? What do you think could be the next steps in terms of the work? And I might have a thought as well.
Yeah, can I give it a try first, Luca? I actually would like to address the same question also to the audience, because it is true that I think that we're all a little bit have a habit of circulating in our own scope of, where do we talk, to whom do we talk, and where do we push this issue. One thing that I really believe in is that we should really try to unite more and more between the drug user and the sex worker community on this issue. There seems to be a lot of overlap, and it can be really powerful to unite, because there are two movements, if you like, that have their own leverage, their own political entry points, perhaps. So that I really strongly believe in. Of course, immediately I'm thinking of, all this UN stuff, but that's, whatever you can achieve in these areas will take very long before that trickles perhaps a little bit down to the real world. I think my answer would be just to circulate this back to the audience and see how any of this work could be useful in your own context as well. Very happy to hear that.
It would be interesting to have a feedback from the audience. You're so right. And
yes, if I can say, like for sex workers, it's really difficult at the moment in Europe. I'm the coordinator of the European network, so that's really what I talk about. Because of this push to criminalize clients and this abolitionist approach that is spearheaded by Sweden and France in particular. So, like in Sweden, France, Norway, the clients are criminalized. And that's bad by itself, but it's also really bad because it means that there is no recognition of a sex worker-led organization. And even allies like Médecins du Monde get caught up in the fire as well. With like, I don't know if you saw at the time, like the offices of Médecins du Monde were tagged, you know, with like anti-sex work messages by organizations who define themselves as feminists. And
we were quite proud of that, actually, Luca.
Huh?
We were actually quite proud of that.
Yeah, no, I mean, it's a very small thing, and it's like, okay, it's a tag and it's like a graffiti, and but it's kind of like ridiculous that, you know, in a country like France, which proud itself as being like human rights and democracy, an organization like Médecins du Monde and sex workers are being attacked for doing, you know, health work, like it is recognized internationally as best practice. And I think it's pretty problematic in terms of funding as well. So with ICRC, we try to have conversation with WHO and UNAIDS and different partners. And often what comes up is that they are quite risk averse because some of the key funders are France and Sweden. And the issue of sex work is so controversial that it actually limits what we can do. So we hope with like the new, you know, global aid strategy and the high-level meeting, there is a, you know, bigger emphasis on providing funding for community-led organization. And we actually have an event next Friday in the evening. If you're all welcome, I'll send the invitation about community-led services and some of the challenges. But for us, I'm not really sure how it's going to go in Europe until we push back against this abolitionist, you know, anti-sex work framework.
Yeah, look, I think from our point of view in drug users, COVID has been a demonstration of the impact of community mobilization. I think, you know, there's quite senior level European policymakers and academics who are saying, no, the future is peer work, the future is community led, which is fantastic. And when they put the money behind it, I'll be even more enthused by that process, because as we highlight, probably European drug user organising has probably about 300,000 euros of investment, including Euro input, including every single one of our member groups. So we're not talking about a 30% of the HIV response, however little it is coming into our communities. So I think I'm very confident in input's ability to take the fight to the international policy structures and get the guidelines put in place to do that type of work. I think what we need to do as Euro input is to think, how can we now go out to each of our governments and say, you signed up to the global aid strategy, and hopefully the forthcoming high-level meeting outcome, you signed up to that. And this global aid strategy isn't just for the 33 countries that are the high-risk countries. This is for every country in the world. So you signed up to that. You fought hard for this 30% criteria. Now let's see us implement it. Now that if there's no point in just signing up to these declarations. You can't hold Russia accountable if you don't deliver it yourselves. So for me, I think we need to start to work with input and start to create advocacy guidelines that allow drug user activists and potentially sex worker activists alongside us to be going to our governments and saying, look, you've agreed to this, how do you do it? And I think potentially also using our allies in the gay men's movement, particularly because of they have much greater engagement with government probably than us at this point. But if we can reflect this international solidarity between the four key populations, I think that would also be the possible way to maximize our impact at this point. But thank you all for a really exciting project, and Euro Input is really happy to carry on building this partnership as we champion standards in peer work, because I think we know how central it is. It needs the funding and it needs the quality standards. And MDM, thank you so much, Ernst, for being such an important champion of this and bringing the resources to it. And also, Sam, thank you for your key driving work behind the scenes.
Thank you all.
Thank you, Luca.
I wanted to say that this is the first webinar we organized in Euro Input, and we're very proud. Thank you all. We're very grateful for your presence. And also I want to mention my colleague, Christo, who set it up, and he was the manager of this project.
Thank you. Thank you so much.
Thanks for this work.
The first series, you mean? The first series, the webinar series?
Yes, yes. It was our first, and I hope not the last, and we hope collaborating with you in many projects to come.
And just can we say thank you also to Correlation, who've been a key partner for us, actually technical backup behind us, meaning that we had to learn one part of how to run a webinar at this first stage, not both parts. So Roberto and your team, and Eon, thank you both for your really generous.
It was great help, as well as the video.
Thanks for having me, and good luck with everything, everyone.
Thanks, Luca.
Bye-bye.
Thank you, guys.
Thank you very much. Thank you.
Thank you. Thank you all.